Hi, I'm Dr. Esther Ganzon Jr., a gynecologic oncologist from Asian Hospital and Medical Center. Today we will be talking about cervical cancer. So what is cervical cancer? Cervical cancer is a cancer that affects women. To orient you, the cervix is located between the uterus and the vagina. In the Philippines, cervical cancer is the second most common female cancer next to breast. So how serious is it? Most of the cases, in fact, are from developing countries such as ours. In the Philippines, 10 women die every day from cervical cancer. So how do you get it? 99% of cervical cancer cases are caused by the human papillomavirus. It is a sexually transmitted viral infection, but sexual penetration is not necessary. Any form of sexual intimacy can transmit the virus, so even if you are in a same-sex relationship, you may still transmit the infection and get cervical cancer later on. So what are the signs and symptoms of cervical cancer? Early cervical cancer may have no signs and symptoms. There will be no discharge or bleeding at all, not even pelvic pain. When the cervical tumor, however, gets bigger, that is when you will experience signs and symptoms. Number one is a foul-smelling vaginal discharge, and then you will have vaginal bleeding not related to your period. You may also experience pelvic pain or pain during sex or leg pain or what we call sciatica. So for advanced cervical cancer, you may also have loss of appetite and significant weight loss. So what are the risk factors for cervical cancer? The better question would be who is at risk? Any woman is at risk, especially if you have engaged in any sexual intimacy or any form of sexual relations. Number one, you increase your risk if you do not have regular cervical cancer screening, meaning you do not go for pap smears or HPV DNA testing regularly. You start at the age of 25 years old every 3 years for liquid-based cytology and every 5 years for co-testing with HPV DNA test, and also every 5 years for primary HPV DNA testing. These are all available in Asian Hospital. Other identified risk factors would be starting sex at a very young age, having multiple sexual partners, or giving birth multiple times. Okay, if you are using oral contraceptive pills continuously for 5 years, that also increases your risk. Having other sexually transmitted diseases also increases your risk for cervical cancer. Cigarette smoking is also an identified risk factor for cervical cancer because of the thousands of carcinogens in the cigarette. Is it treatable and preventable? Of course, cervical cancer is preventable. Primary prevention involves HPV vaccination, so you have vaccines against cervical cancer. You start giving the vaccine as early as 9 years old. For both males and females, the age of vaccination is from 9 to 45 years old. Secondary prevention is, of course, done through cervical cancer screening methods, the most common of which is pap smear, which is readily available in most clinics and hospitals. We also have HPV DNA testing to stratify the risk of these patients for cervical cancer and help in determining how frequently one should be screened or referred for further investigation. Cervical cancer is likewise treatable and curable largely if it is early stage. One can either undergo radical surgery with or without the combination of chemotherapy and radiation. For advanced stage cervical cancer, hospitals such as Asian Hospital and Medical Center are fully equipped to offer treatment such as chemotherapy, radiation therapy, and targeted treatment. So what are the available screening tests for early detection? Of course, we have pap smears. My favorite is the liquid-based cytology for ease of use and accuracy. We also combine HPV DNA tests with your cervical cancer screening. For patients with abnormal pap smear results and positive HPV DNA tests, these patients refer to us gynecologic oncologists for further investigation. Colposcopy and biopsy are offered and performed on these patients to see if they indeed have precancer lesions of the cervix. And these services are available here in Asian Hospital. We encourage everyone To go for cervical cancer screening tests, it's available in Asian Hospital. You may go to your obstetrician gynecologist or your gynecologic oncologist, or here at the Asian Cancer Institute, we have the Simply Woman Clinic. You may call 8871-9000, local 5763.